Like other mountain communities, Eagle County in Colorado has faced significant behavioral health challenges for years, with a rise in suicides, increased substance abuse, and growing mental health issues among school children, all compounded by limited access to licensed providers.
Recognizing the need for change, community leaders came together to address these critical problems. It became evident that a comprehensive, community-centered system was needed.
In response, Vail Health established Eagle Valley Behavioral Health, or EVBH, in 2019, with an initial investment of $60 million. EVBH's mission is simple, yet profound: to lead community collaboration to transform Eagle River Valley's behavioral health system.
Later that year, Vail Health Foundation launched It Takes a Valley, transforming behavioral health for EVBH and our nonprofit partners using a collective impact model to raise $100 million together, bringing the organization's total commitment to $160 million over 10 years.
EVBH allocated $3 million to 30 local organizations in its inaugural year. This funding sparked a major shift, and a community network emerged as the foundation of a behavioral health initiative.
Key nonprofit partners include Bright Future Foundation, Your Hope Center, My Future Pathways, Speak Up, Reach Out, and Mountain Pride.
The contributions of our organization, partners, and benefactors have resulted in extraordinary accomplishments over 4 short years. A key focus has been increasing behavioral health access and capacity for individuals and families. We developed internships, student scholarships, and loan forgiveness programs to recruit and retain clinicians to live and work in our community.
Our 10-year goal was to bring an additional 50 licensed behavioral health providers to the Valley. We recruited more than 60 new providers, half of whom work for Vail Health Behavioral Health and accept commercial insurance, Medicaid, and Medicare. We also contracted with an additional 100 private providers across Summit and Eagle counties, who all accept our Mountain Strong Employee Assistance Program and Olivia's Fund.
Behavioral health has been fully integrated into services at Vail Health. Similarly, Mountain Family Health Centers offer a comprehensive care system that incorporates primary, behavioral, and dental health care, specifically catering to the medically underserved, regardless of their ability to pay.
The Behavioral Health Peer Support Program offers a wide range of group-oriented care, including support for grieving moms, LGBTQ+ individuals, Hispanic youth and adults, recovery mountain bike rides, and more.
Olivia's Fund provides 6 free behavioral health sessions annually for anyone who lives or works in the Eagle River Valley and demonstrates a financial need. Since 2020, Olivia's Fund has supported over 8,400 therapy sessions with a counselor free of charge, with 645 sessions in Spanish.
We are channeling resources into prevention and education programs. The Long Live marketing campaign helped reduce the stigma surrounding mental health in our community. We support nonprofits like Speak Up, Reach Out, which is dedicated to preventing suicide through training, awareness, and hope.
EVBH worked closely with Your Hope Center to create Colorado's only 24/7 mobile crisis co-response system, funded by the state's Behavioral Health Administration. EVBH also supported the development and implementation of Your Hope Center's Community Stabilization Team, available 5 days a week, reducing behavioral health transports that previously would have been sent to the emergency department or jail.
Eagle County, EVBH, the Eagle County School District, and Your Hope Center set an ambitious goal in 2020 to place a licensed, school-based clinician in every public elementary, middle, and high school in our county. Thanks to generous donations, we achieved that goal this year.
Vail Health's Mountain Strong Behavioral Health EAP was expanded to other employers in Eagle County, increasing access, improving outcomes, and lowering patient costs.
Led by Bright Future Foundation, Victim First Care removes barriers to medical care and behavioral health care for anyone who has experienced sexual assault or interpersonal violence. Before, individuals traveled up to an hour away to get the care they needed.
In 2022, the state of Colorado designated EVBH as a Community Mental Health Center, or CMHC, in Eagle County, the only organization to receive this designation in over 40 years. As of July 2023, we are the designated CMHC for Summit County, dramatically expanding access to care across the mountain communities we serve. EVBH and Vail Health have actively pushed for mental health parity, health insurance reform, and improved behavioral health Medicaid reimbursement, all of which reduce the cost of care and improve patient access. Across the nation, commercial insurers pay significantly less to providers for behavioral health services than physical health services, violating federal parity laws requiring equal coverage for behavioral health and physical health.
Through our collaborative efforts with local primary care practices at Colorado Mountain Medical, we successfully negotiated contracts with commercial payers, achieving behavioral health rates that are on par with medical rates in the Eagle River Valley as of August 2023. This accomplishment paves the way for the sustainability of mental health and substance abuse treatments our behavioral health providers offer. Furthermore, patients can now use their insurance for necessary behavioral health care services.
We are creating a hub for behavioral health on the Edwards Community Health Campus. In February 2023, we celebrated the opening of the Uyghurs Mental Health Clinic, named in honor of George and Betsy Uyghurs Family Foundation. This new clinic is home to numerous outpatient services and treatments, including child and adolescent psychiatrists, case managers, medically assisted treatment for substance abuse issues, group and intensive outpatient programs, and more.
In 2023, we announced the Vail Health Behavioral Health Innovation Center, a collaboration between Vail Health and the University of Wisconsin-Madison. Led by Dr. Charles Raison and with the support of a lead gift from Mike and Mary Sue Shannon, the Innovation Center will become a world-class destination for pioneering behavioral health research, treatment, and education.
Vail Health's total investment in behavioral health has increased to more than $200 million. This is just a snapshot of what EVBH has accomplished in 4 short years. We look forward to the opening of the Precourt Healing Center, a 50,000 square foot inpatient behavioral health facility made possible by generous donations from the Precourt family and other benefactors. As behavioral health care continues to grow within the Vail Health system, these services are now aligned under the Vail Health Behavioral Health brand, including EVBH, Mountain Strong EAP, the Uyghurs Mental Health Clinic, and the Precourt Healing Center.
With the generous support of the entire community, EVBH and our partners are revolutionizing our behavioral health system and building a model that can be replicated in communities across the country.
Through our collective efforts, we are one step closer to our vision. Imagine a day in this valley where we spend as much time, effort, and resources on our behavioral health as we do on our physical health.